NeuroStar TMS therapy. Remission from depression is possible. Severe depression is a serious illness that affects approximately 350 million people worldwide. According to the World Health Organization, depression is the leading cause of disability. Although medications can help manage depression symptoms, adequate treatment is difficult to achieve in most patients with standard drug therapy due to lack of efficacy or intolerable side effects. Many patients seek different treatment options in order to relieve their depression, but the likelihood of achieving remission declines with each subsequent treatment. So patients are more likely to discontinue treatment. Patients with depression who are not benefiting from their current antidepressant medication need a different approach to achieve remission. NeuroStar TMS therapy, the first FDA-cleared TMS treatment for depression. Backed by the largest TMS clinical data set, 6 studies with 800 patients. NeuroStar also has CE mark approval and is available internationally. TMS, or transcranial magnetic stimulation, uses targeted magnetic fields to treat major depressive disorder. NeuroStar TMS therapy is a proven, safe, and effective treatment option for patients with major depressive disorder. The NeuroStar system consists of a mobile console that houses the power electronics and interfaces with a number of components, including the touchscreen display, the TrackStar server, and the coil module. The graphical touchscreen user interface is designed to provide an organized workflow, capture treatment session data, and ensure the optimal treatment dose. The integrated treatment coil is the magnetic treatment coil that delivers TMS therapy to the desired brain region. The precision pulse technology results from the proprietary C-shaped iron core coil that focuses the magnetic field, allowing targeted stimulation of the area of the brain that you want to treat. Several different areas of the brain regulate mood. Neuroimaging studies of healthy and depressed patients have shown different patterns of metabolic activity of these different regions. The brain regions involved in mood regulation are connected through neuronal pathways. These neuronal circuits communicate by releasing neurotransmitters. When there is an appropriate amount of neurotransmitters within these pathways, communication between brain regions is optimal and the mood circuit functions normally. However, in depressed patients, neurotransmitters become depleted or dysfunctional, and communication between mood regions is disrupted. Increasing the amount of neurotransmitters is an established approach to treating depression. Neurons and their release of neurotransmitters can be affected either chemically or electrically. Traditionally, drugs have been used to chemically increase the amount of neurotransmitters. However, because antidepressant medications are systemic, they elicit undesirable effects in the brain and throughout the body. NeuroStar TMS takes a different approach, exploiting the fact that neurons are electrochemical cells. It uses a targeted electromagnet to produce a pattern of pulsed magnetic fields. This electric current is powerful enough to elicit an action potential in neurons, causing the release of more neurotransmitters at the synapse. In addition to these local effects, NeuroStar TMS activates deeper brain regions that lie outside the direct action of the pulsed magnetic fields. Energizing these deeper brain regions causes secondary activation of brainstem neurotransmitter centers, which stimulates other brain regions involved in mood regulation. NeuroStar TMS therapy offers a unique mechanism of action by directly depolarizing local neurons, which modulates connected deeper brain regions. This allows NeuroStar TMS therapy to affect both local and deep neural circuits, all without causing unwanted systemic side effects. A typical course of NeuroStar TMS therapy consists of daily treatment 5 days a week for 4 to 6 weeks. Each treatment session lasts 37 minutes. No anesthesia or sedation is required. At the first treatment session, the physician will start by using the treatment to perform a test to identify the patient's motor threshold. For NeuroStar TMS therapy, the motor threshold is the amount of magnetic field strength that results in a visible movement of the patient's right thumb. This test is important because it identifies the magnetic field strength that will be used in treatment. This field strength is customized for each patient to deliver the correct treatment dose. The motor threshold test will also identify the position on the patient's head in which to place the treatment coil to allow the patient to receive optimal treatment. When the physician or TMS treater begins the TMS therapy session, the device will deliver rapid pulses of the magnetic field in 30-second intervals. To the patient, this may feel like tapping on the scalp. Patients are awake and alert during the session and may return to normal activities immediately following treatment. NeuroStar TMS therapy is a proven, safe, and effective treatment option for patients with major depressive disorder who have not experienced satisfactory improvement with antidepressant medications. In a difficult-to-treat patient population, NeuroStar demonstrated consistent response and remission rates. 1 in 2 patients respond to treatment, and 1 in 3 achieve remission of depression symptoms. Not only is NeuroStar TMS therapy effective, the effects have proven to be durable. During a 6-month follow-up study, only 11% of patients experienced a relapse. 37% of these patients required reintroduction of TMS. 85% of these patients re-achieved clinical benefit. NeuroStar TMS is safe. Patients receiving NeuroStar TMS showed none of the systemic side effects associated with chemical antidepressants. The most common side effect was pain or discomfort near the treatment area. NeuroStar TMS therapy is the first FDA-cleared TMS device for the treatment of major depression. This established treatment has a proven efficacy and safety profile in treating these patients. NeuroStar TMS therapy accomplishes these effects safely, without the unwanted systemic adverse effects associated with chemical antidepressants.